Hello students, this is Dr. Pooja Thakkar from Inside Biology. In this particular session, we need to discuss regarding reproductive health. This is supremely important for each and every living beings on the earth. So the basic introduction I'm giving you, that is, as per WHO, the concept of reproductive health is basically defined as it is a state in which people have the ability to reproduce as well as to regulate their fertility period. Women are there able to go through the pregnancy period as well as the childbirth in a very safe way. The maternal as well as infant survival and well-being is very important, and the couples in this particular phase is able to have sexual relation free from any kind of fear of pregnancy by using the contraceptions and to avoid contracting diseases. Now, in biological term, the mechanism of human body is super complex, and the body passes through many different phases, as we can understand, that is the childhood, the adolescence, the adulthood, and the elderliness. Each phase is basically associated with several bodily changes, especially adolescence. These includes the physiological changes in a body, that is the development of gonads. During this particular phase, the nutritional requirement and the knowledge about this plays a significant role to improve reproductive health. As we have already discussed, that is the ability of a particular person to reproduce and regulate the fertility, maintain pregnancy and childbirth in a very safe way. Okay, so lot many studies are there which shows that there is a strong association between the education as well as the reproductive health services. If adolescents are provided with formal education on the reproductive health, it prepares them for typically pubertal changes that happens during the particular age, that is puberty, and they also empowers them to improve their long term health as well as equip them with the skills which are necessary to take care of each and every children. Unfortunately, in India, sexual health is super poor in rural and urban regions. So many factors are associated with this particular services. As in the current scenario, reproductive education is not at all provided in the school curriculum. Even if it is present, teachers do not teach these kinds of topic due to embarrassment. I don't know how and why. As a result, the adolescent population is not provided with adequate knowledge, and whatever information they receive is from the peer networks, right? Which can be incomplete, inaccurate, and entangled with lots of myths. So, no single reason can be blamed for the poor reproductive health typically of youth in India. So many factors are responsible for these to improvise the reproductive health. The first one is education, second is child marriage, third important thing is economic status, gender, social status, as well as age. So these factors will go in detail in the next slides. First of all, I'd like to discuss regarding education. Many young girls are unaware of menstruation before they attain the menarche period, that is the beginning of menses. This makes it very difficult for them to keep the menstrual health as well as hygiene at required standards. Instead of these, adolescent girls often follow the cultural traditions, which are super tedious as well as horrible. Indian society considers menstruation is unclean. It is because of that, so many menstruating girls have faced behavioral restrictions at this particular time period. The girls are not at all allowed to bath or attend places of worship, schools, and family functions. The girls are not prohibited from eating certain kinds of foods, and they are restricted from performing physical activities too. The girls are provided with rags to absorb blood still, and these rags are reused, which can be very dangerous for them. Such unhygienic practices increases the risk of reproductive tract infection, that is RTIs, and that can lead to many serious gynecological consequences in future. that can impact their reproductive health. The second and the most important thing is child marriage. It is still very common in some places, in some regions in India, despite of being declared by the government that is illegal. 60% of female are married before 18 years of age, and 70% of these have their first child within the 1 year of marriage. The prevalence of child marriage and its effect has a lot negative implication on the women's reproductive health as well as child's well-being. They are not at all ready for that at this small age. Girls marrying at young age often conceive at a very young age. They don't have enough knowledge regarding the contraceptives and they are not allowed to use the same. This is super difficult for them. Also, they lack knowledge about commonly occurring diseases, that is sexually transmitted diseases, which is termed as STIs, and their prevention. The next most important thing need to or I like to discuss is pregnancy related care and services are often considered as very irrelevant and unnecessary in India. However, young mothers lack timely medical care, often have inadequate diet, and have a heavy workload during gestation period or the pregnancy period that will lead to many complications during their pregnancies and high maternal mortality rates too. These women have high levels of anemia maybe during the pregnancy as they don't have enough access to regulate their iron level in the body as well as folic acid levels in the body by irregular uptake of this iron and folic tablets. There is an intense pressure from the families also and communities also to prove their fertility, and the most horrible thing is to bear sons. The third and the most important thing is poverty. 60% of world's extremely poor people live in India. Ladies from poor economic background resume work soon after the delivery. As a result, they have poor health during the lactational period also, which can adversely affect the child's health. In India, on average, there is one maternal death every 12 minutes. It's so sad. The fourth important factor is gender inequality and domestic violence. Usually, it is commonly found in many rural women in terms of maternal as well as reproductive health. Home births are still remain the most common practice, with the very few deliveries taking place in the health facilities. Moreover, women are brutally beaten, stabbed, and raped during the pregnancy, which has a serious negative impact on their health as well as on their brain and for the child's health too. The caste system. People of socially backward class, which includes basically ST and SC group, where people often economically poor. This of people of the other backgrounds too, that is Muslim communities. Muslim women typically are found to be less likely to be sterilized as well as less likely to be using contraceptive pills or any other kind of contraceptions in compared to the non-Muslim women. The government has initiated many schemes like skilled birth attendants and folic acid supplements and financial aid for pregnant women. But women belonging to these categories are less likely to obtain such goods services since caste prohibit them from receiving such benefits, which ultimately impacts the health of the mother as well as child. The next important factor is adolescent reproductive health. People indulging in premarital sexual relationship don't have enough reproductive knowledge. Unmarried young women experiences many difficulties in accessing timely abortion care due to late recognition of pregnancy as well as difficulties in accessing the health care. So what we can think for the resolution? This is the super important thing, and because of these kinds of factors we need to avoid it, and for that we need to focus or we need to resolve by focusing on or taking guidance or the benefits from varieties of centers, governments, as well as multiple efforts which has been played by different agencies. So the International Center for Research on Women, that is ICRW, has started a 10-year research program in different parts of India on the measure to identify the knowledge, attitudes, and the health outcomes. These include checkups for expectant mothers, delivery with a skilled attendant, postpartum care, that is after delivery care, access to safe abortion, and contraception that can save many, many, many lives. Maternal mortality could be reduced through the health, timing, and spacing of birth. Both the governments, that is central as well as state government, has launched many programs and schemes which are aimed to improve and maintain the health of these people. The termination of pregnancy has been legalized and the Indian abortion guidelines have been revised by Parliament of Republic of India, that is 2002, World Health Government or World Health Organization, you can say, that is in 2012. They include varieties of techniques, or you can say new technologies like medical abortion and manual vacuum aspiration, that is MVA, to improvise the female health as well as the fetal health. Now, these are some organizations which are playing a significant role in the improvisation. The first one is the Adolescent Health and Development Strategy, that is AHDS. The program was launched by Minister of Health and Family Welfare, Ghulam Nabi Azad, and was developed with the support of United Nations Population Fund, that is UNFPA. The government is mainly focusing its priorities on the rights as well as well-being of the women on large and increasing adolescent as well as youth population. They are focusing youth to mainly do a specific kind of work to improvise the economy of the country. This is why the government is making smart investment in health, education, and job creation. The next organization is National Rural Health Mission, that is NRHM. The Government of India has launched NRHM to carry out a necessary architectural correction in the basic healthcare delivery system. The mission targets are improving the ability as well as the access to quality healthcare, especially for those residing in rural areas, for the poor people, typically for women as well as children. In addition, the other goals of this particular mission is to focus on infant mortality rate, that is IMR, and maternal mortality rate, that is MMR. They have mainly focused in reduction of these rates. The NRHM provides a variety of short and long acting contraceptive methods as well as abortions are legal for 20 weeks. The plan focuses on different aspects also, that is good health, including the segments of nourishment as well as sanitization, hygiene, and safe drinking water, prevention as well as control of communicable as well as non-communicable diseases. This particular program is also working on population stabilization, gender equivalence or gender balance, and the promotion of healthy lifestyles. Under the specific NRHM program, one more organization is working, that is Reproductive Maternal, Newborn, Child and Adolescent Health, which was launched in 2013. It is basically addressing the major causes of mortality among women as well as children, as well as it is mainly focusing on delays in accessing and utilizing the healthcare as well as services. It took into the issue like screening of birth defects, diseases, deficiency among the children as well as adolescents, and it also focuses on anemia, and a plan they launched that is named as National Iron Plus, since anemia majorly affects a woman's health. The state government is also running multiple projects in parallel to implement many schemes that include state subsidization on sanitary towels, awareness campaigns, and incorporation of sexual health modules in the school curriculum, which is currently restricted to optional biology lessons. The educational programs in the schools are helping girls to have a better understanding of pubertal changes, menstrual hygiene, reproductive tract infection, contraception, and sex itself.